My name is Mary Sandilands. I'm a social worker with the Western Health and Social Care Trust. I work in an adult learning disability team. We work as a part of a multidisciplinary team, and our role is to assess needs, strengths, risks and protective factors, and to plan for the delivery of services in a person-centred and personalised way to meet needs identified and to minimise risks. One of the first cases that I was allocated when I started working with the learning disability team was that of a family with a daughter with Down syndrome. The family were frustrated and I suppose maybe a bit disillusioned with the services that they had received to date, or the lack of services. The family lived in quite a rural area and there was very little public transport or any form of transport to facilitate their daughter going to and from her various daily activities. Historically, the carer in this case had been providing all the transport, but she had recently returned to work, and this was becoming increasingly difficult for her and putting more pressure on her to the stage that her daughter wasn't actually getting to some of the activities that she enjoyed. Immediately I thought that this may be a good case for self-directed support. It would be self-directed support would allow the family to tailor the services to meet their own needs. So I met with the family and spoke to them about self-directed support, and immediately I think that they felt that this was something different and that would be able to help them. So I started through the process. I did my assessment and I brought my application to the Community Access Panel. On your application you have to demonstrate that the eligibility criteria is met and that it is a critical need. Fortunately it was approved at the panel and the family were approved with a personal budget. At this stage I went and met with the family, provided them with their letter of offer, which clearly sets out the personal budget that they have to work with, I suppose, to plan their services, and also then we do the support planning process, and this sets out really what the service user and the carers are going to use their personal budget for, and in this case obviously it was for transport to and from the service user's activities. This process hasn't been complete yet. The family are just starting to receive their direct payments. However, already I think the family have acknowledged that how this is going to benefit them. They are able to tailor their support package to meet their own needs rather than being limited by traditional services that may have been there. For me, I think the self-directed support process is very simple. I used the flow chart, I kept it close to me as somebody that was just learning about the process, and I found it very useful to keep me on the right track, I suppose. Also, I think that it's very person-centred. It is a step away from traditional services, and it allows families to tailor the support that they receive, and there's more flexibility in the support that they receive. But also I think it maybe encourages practitioners to adopt a more innovative approach rather than looking just at what was available in the past. You can use the money or the personal budget in different and more creative ways.